my approach. And here, at our clinic, everyone is certified brain health coaches through the Amen clinics. I described Amen's method as being like a rocket booster on traditional cognitive behavioral therapy. Many of us are familiar with traditional cognitive behavioral therapy. It's very effective, yet when you combine that with Dr. Amen's approach, the brain-based approach, it really helps people understand how their brain is working, where it might be a little underactive, where it might be a little overactive. It helps the clinician better target treatment and help people get more motivated to do healthy brain habits, because one of our goals is to develop brain envy in everyone we work with through this education. I have to say, it's maybe been 17 years ago now that I was in a training in Clearwater, and Dr. Amen was presenting, and I was just blown away to finally the integration of medical science with what I was doing. And I knew through my own work that I had done, with in my own journey of healing, that it is real. Like, you can change your brain. I just couldn't explain it to people as effectively as Dr. Amen's pictures do. Yeah, we can actually see that we don't have to be stuck with the brain that we have. And that gives people tremendous hope. The other interesting thing it does is it helps us separate from the thoughts that we're thinking. So, many of us, we come in and it's like, well, this is how I am. These are the thoughts I'm thinking. I can't help it. And in actuality, our brain is an organ that's it's designed to think thoughts. It doesn't care what it thinks about. It's just going to generate thoughts. And based on its operation, it's going to generate certain types of thoughts. Up to us to evaluate those thoughts. And I call that steering our brain. I really, I mentioned the spiritual component, going from a premise that we are spiritual beings operating in this physical universe, that we need to steer our brain in the direction of our health and well-being. Hormonal balance is huge.
I know.
We're learning now, of course, things with oral contraceptives that weren't as great. Maybe, women are having longer term issues from the use of oral contraceptives that have affected their hormonal balance long after they've stopped using them. Things like that we have access to now, like hormone replacement therapy. This is really critical for women's health. And more women now are having access to that. But having a good practitioner, I think that's when it comes to hormone replacement or any of these things, right? Practitioners and trusted practitioners that you can work with, that you feel comfortable with, that's going to listen to you and help you, get this right balance to the hormone replacement. So the hormone levels, the hormone replacement, understanding how important it is to manage our hormones. Diet, of course, we know can also affect our hormones, limiting sugar. And again, chronic stress, we were just talking about that. The other things that affect, as women, that is the extra stress that we get from family relationships. We tend to find ourselves in the caregiver roles. As women, we're more nurturing, yet there's caregiver burnout, and there's also the need for boundaries. And yet sometimes women feel selfish if they put those boundaries in. And yet we have to protect ourselves and know that loving ourselves, caring for ourselves, is then going to increase our ability to go the long haul in helping others. I love this because what Dr. Amen's work does is it helps both the clinician and the client, the person we're working with, understand how their brain is working so we can better target treatment. So it becomes like a validation. So when somebody comes in and they've had that trauma, but they're saying, well, that was 20 years ago, 30 years, it's just so far in the past. But we're looking at their brain scores, Dr.
Mhm.
work, and it's like, well, we've got these high scores in these areas, so it's showing up in your life today. And I think, that if we treat this with EMDR and
Mhm.
help the brain heal from that, you're going to be able to have more ease around this. Because, again, as women, what do? We blame ourselves. Oh,
Mm.
what's wrong with me? Why can't I handle this? Or, I get so frantic, I get overwhelmed. And then we get mad at ourselves, like, why
Yeah.
can't I do it? And, put that extra pressure on versus going, oh, wait, I had this injury back here that
Mhm.
never really got addressed. Kind of like if we had broken our arm back
Yeah.
in, and it never really got set properly.
Yeah.
Expecting ourselves to move and use that arm to lift the heavy loads of our life today, and yet it's causing us trouble. We don't have to do that. So that
Yeah.
coach helps people understand more about the value of treatment, why it answers that why, like, what's wrong with me? It's like, there's nothing wrong with you. This is like normal for what would
Yeah.
happen for experiences like that. And that brings a lot of relief. This is a great image. I love this so much. Dr. Amen calls it the grateful and hateful. So
Mm.
is the same woman's brain. And on the left, he had her come in and think about everything she loved about her life. And this is an underside view. But what we want to see is that fullness. The underside, we're going to get a little bit of some of those indentations, but you can see overall the fullness. And then he had her come back, and to some degree, under some protest, she was like, I don't want to think about everything I hate about my life. Wise woman. Yet, think about everything you hate about your life. And then scanned her brain. And you can see these differences, and these
Mm.
differences, the visual almost doesn't even do it justice, although these are deep areas where we're
Mhm.
not seeing enough blood flow and activity for the brain to be optimally functioning. And so, when it comes to quality of life, we see many women are actually the number, higher than men in dementia, Alzheimer's.
Yes.
Yes.
Yeah,
So,
I heard
and
that.
this is, they're really looking at this as a lifestyle disease. And yet, women are more, stressed and more vulnerable because of the things we've been discussing. And so it's easy to slip into getting stuck on those negative thoughts, being, kind of buckling under the burden of these stresses and slipping into the focus on the negative parts of our life. And so we want to, it matters. It matters what we think. We want to help ourselves move into that gratitude, doing that gratitude exercise, which is finding 5 things you're grateful for. And I like to tell people, say them 10 times in a row, 3 times a day with feeling. And they found that in 3 weeks, that worked better than any antidepressant on the market.